You've been told the same advice for decades. If you want to stay healthy after 60, just keep walking. Walk every morning. Walk after dinner. Count your steps. But what if that advice is incomplete and quietly holding you back? What if the very habit you rely on to stay mobile isn't enough to protect you from weakness, balance loss, or the slow decline that sneaks up year after year? Ask yourself this: why do so many people over 60 who walk every day still struggle to stand up from a chair, climb stairs, or avoid falls? Why are orthopedic clinics filled with active seniors who did everything they were told? And why are surgeons beginning to rethink what truly keeps the body strong and independent later in life? Aging doesn't steal independence overnight. It happens quietly, through muscle loss, weaker joints, and thinning bones. You may feel fine today, but small losses compound. One day getting up feels harder. Another day you hesitate before stepping off a curb. Eventually, confidence fades. The most dangerous part? Many people believe this is just normal aging, when in reality, it's largely preventable. What if there were a safer, more targeted way to rebuild strength exactly where the body loses it most after 60, without long walks, without gym machines, and without stressing your joints? And what if this approach wasn't a trend, but something surgeons and rehabilitation specialists have been using quietly for years? In this video, we will reveal 5 exercises that directly target strength, balance, and bone health using a simple chair. Movements designed specifically for adults over 60. Most importantly, the #1 exercise on this list increased bone density by 19% in participants over 65. Surgeons are now prescribing this exact movement to patients recovering from hip replacements because it works better than many traditional physical therapy protocols they have used. Before we get started, welcome if this is your first time here. How old are you right now? Drop your age in the comments. We are reading and replying to each single one. Hit like, subscribe, and drop your country in the comments so we know where our family is growing from. Let's begin. Number 5, seated calf raises. Seated calf raises may look simple, but they play a powerful and often overlooked role in maintaining lower body health after 60. Most people think of calves as walking muscles, yet their most important function has nothing to do with steps. The calf muscles, specifically the gastrocnemius and soleus, act as a secondary heart for your body. Every time they contract, they help push blood upward from the legs back toward the heart, a mechanism known as the venous pump. As we age, this pump becomes weaker. When calf strength declines, blood has a harder time traveling against gravity. This leads to poor circulation, ankle and foot swelling, heaviness in the legs, nighttime cramps, and an increased risk of varicose veins. In more serious cases, sluggish blood flow raises the risk of deep vein thrombosis, a potentially dangerous condition. Many older adults experience these symptoms without realizing that weak calves, not the heart, are often the root cause. This is where seated calf raises become so valuable. Because the movement is performed sitting down, it places minimal stress on the hips, knees, and lower back, making it ideal for seniors with arthritis, joint pain, or balance concerns. Despite being gentle on the joints, it strongly activates the calf muscles and restores their pumping action. A 2021 clinical study published in the Journal of Vascular Health examined adults over 60 with mild circulatory impairment. Participants who performed seated calf raises 3 times per week for 12 weeks showed significant improvements in venous return efficiency, reduced ankle swelling, and reported less leg fatigue compared to a non-exercise control group. The researchers concluded that targeted calf activation was one of the most effective non-pharmacological ways to improve lower limb circulation in older adults. To perform seated calf raises correctly, sit upright in a sturdy chair with your feet flat on the floor and knees bent at about 90 degrees. Press through the balls of your feet and lift your heels as high as you comfortably can. Hold the top position for 2 full seconds, focusing on squeezing your calves. Then lower your heels slowly back to the floor, taking about 3 seconds on the way down. This slow lowering phase is crucial because it strengthens the muscle fibers and improves tendon health. Start with 15 repetitions to learn the movement. As your strength improves, gradually work up to 3 sets of 20-25 repetitions. Once this becomes easy, You can add light resistance by placing a book, a small weight, or even a filled water bottle across your thighs. The added load increases muscle activation without increasing joint stress. Beyond circulation, strong calves also improve ankle stability, balance, and walking confidence, which directly reduces fall risk. Many surgeons and physical therapists now include seated calf raises in rehabilitation programs because they safely rebuild strength while supporting overall vascular health. Simple, safe, and surprisingly powerful. This exercise quietly protects your legs, your circulation, and your independence as you age. Number 4, seated knee extensions. Seated knee extensions may look basic, but they target one of the most critical muscle groups for independence after 60, the quadriceps. These large muscles on the front of your thighs are responsible for standing up from a chair, climbing stairs, stepping off curbs, getting out of a car, and stabilizing your knees during daily movement. When quadriceps strength declines, everyday tasks become harder, balance worsens, and the risk of falls increases dramatically. Research consistently shows that adults over 60 lose quadriceps strength faster than almost any other major muscle group if they do not perform targeted resistance exercises. This loss is not just about strength. It also affects reaction time and joint stability. A weakened quadriceps muscle cannot adequately control knee movement, placing more stress on cartilage and ligaments. Over time, this contributes to knee pain, arthritis progression, and reduced confidence when walking or standing. Walking alone does very little to prevent this problem. On flat ground, your quadriceps are only lightly engaged because your body weight is evenly distributed and there is minimal resistance. The muscle is essentially coasting. Seated knee extensions, on the other hand, force the quadriceps to lift the lower leg directly against gravity. This creates the mechanical tension needed to stimulate muscle fibers, preserve muscle mass, and even rebuild lost strength. A 2018 study published in the Journal of Aging and Physical Activity followed adults aged 65 to 80 over a 16-week period. Participants who performed seated knee extensions 3 times per week increased quadriceps strength by an average of 22% and showed significant improvements in chair stand speed and stair climbing ability. In contrast, the control group that relied on walking and daily activities alone experienced continued muscle loss. This study confirmed that even simple seated resistance movements can reverse age-related decline when performed consistently. To perform seated knee extensions correctly, sit tall in a sturdy chair with your back supported and feet flat on the floor. Grip the sides of the chair lightly for stability. Slowly straighten one leg until the knee is fully extended and your toes are pointing toward the ceiling. At the top, hold for 3 seconds and consciously squeeze the thigh muscle as hard as you can. This intentional contraction is key. It improves neuromuscular activation, which declines with age. Then lower the legs slowly over 4 seconds, resisting gravity the entire way. Switch legs and repeat. Start with 10 to 12 repetitions per leg and aim for 3 total sets. As the movement becomes easier, progression is essential. You can add light ankle weights, loop a resistance band around the ankle, or increase the hold time at the top. These small increases signal the muscle to keep adapting. Orthopedic surgeons and physical therapists frequently prescribe seated knee extensions because strong quadriceps act like natural shock absorbers for the knee joint. They reduce joint stress, improve walking efficiency, and help protect against degenerative changes. More importantly, maintaining quadriceps strength allows you to stay independent, confident, and mobile, without relying on assistance for basic daily tasks. Number 3, seated hip marches. Seated hip marches may look simple, but they train one of the most critical muscle groups for safe, confident movement after 60. Your hip flexors. These muscles, primarily the iliopsoas and rectus femoris, are responsible for lifting your leg every time you take a step. Without enough hip flexor strength, your foot does not clear the ground properly. That is when shuffling begins, reaction time slows, and the risk of tripping on curbs, rugs, or even small cracks in the floor rises sharply. This is not just theory. A large observational study published in 2018 and referenced by clinicians affiliated with the Mayo Clinic found that hip flexor weakness was one of the strongest predictors of falls in older adults. Participants with the weakest hip flexors were several times more likely to experience a fall within the following 12 months compared to those with preserved hip strength, even after accounting for age, walking speed, and general activity level. In other words, you can still be active and walk regularly, yet remain at high risk if these muscles are neglected. Falls are not minor setbacks in later life. According to public health data, approximately 1 in 4 adults over 65 falls each year, and many of these falls result in fractures, head injuries, or long hospital stays. Even when there is no major injury, a fall often creates fear. That fear leads people to move less, which accelerates muscle loss, balance decline, and overall frailty. Strengthening the hip flexors is one of the most direct ways to interrupt this downward spiral. Seated hip marches are especially effective because they isolate the exact action most people lose with age, lifting the leg against gravity in a controlled way. Walking does not fully address this because the ground assists your movement and limits how hard the hip flexors must work. In a seated position, gravity becomes the resistance, forcing the muscles to engage fully. To perform the exercise correctly, sit on the front half of a sturdy chair with both feet flat on the floor. Do not lean back. Sit tall, lengthen your spine, and gently engage your abdominal muscles as if bracing for a light cough. Slowly lift one knee toward your chest as high as is comfortable without leaning backward. Hold the top position for about 2 seconds, feeling the muscles at the front of your hip work. Then lower the legs slowly and with control. Alternate legs for a total of 20 repetitions and complete 3 sets, resting about 1 minute between sets. As strength improves, you can increase the challenge by slowing the movement, extending the hold at the top, or adding light ankle weights. This exercise does more than strengthen the hips. It also trains coordination and balance, because your core must stabilize your body while one leg is lifted. Over time, this translates into better walking mechanics, higher foot clearance, and a dramatically lower risk of stumbling. For adults over 60, seated hip marches are not just an exercise. They are a protective strategy for independence, confidence, and long-term mobility. Number 2, seated rows with a resistance band. Every time you pull something toward your body, opening a heavy door, pulling yourself up from bed, carrying groceries, or even steadying yourself when you lose balance, you rely on the muscles of your upper and mid-back. These muscles include the latissimus dorsi, rhomboids, middle and lower trapezius, and the rear deltoids. Together, they keep your shoulders back, your chest open, and your spine upright. After 60, these muscles often weaken faster than people realize, especially if daily movement is limited to walking alone. When the back muscles lose strength, posture begins to collapse forward into a rounded, hunched position known as kyphosis. This does more than change how you look. A forward rounded posture shifts your center of gravity, making balance less stable and increasing fall risk. It also compresses the chest, reducing lung expansion and making breathing more shallow. Over time, this posture places excess strain on the neck, shoulders, and spinal discs, often leading to chronic pain, stiffness, and headaches. Walking does little to prevent this because it involves almost no pulling or upper body resistance. Seated rows with a resistance band directly target this problem. They strengthen the exact muscles responsible for pulling the shoulders back and stabilizing the spine. A 20-21 randomized controlled trial published in the Journal of Aging and Physical Activity examined older adults aged 65 to 80 who performed seated rowing-type resistance exercises 3 times per week for 12 weeks. Compared to a walking-only group, the resistance training group showed significant improvements in upper back strength, spinal alignment, and shoulder mobility. Participants also reported reduced neck and upper back pain and greater confidence in daily movements such as standing up, carrying objects, and maintaining balance. To perform seated rows safely, sit tall in a sturdy chair with your feet flat on the floor and hip width apart. Loop a resistance band securely around the midfoot or soles of your shoes. Hold one end of the band in each hand with your arms extended forward and palms facing each other or down. Before pulling, gently brace your core and keep your chest lifted. Pull your elbows back and slightly down, squeezing your shoulder blades together as if you are trying to pinch a pencil between them. Hold this position for 2 seconds to maximize muscle activation, then slowly return to the starting position under control. Avoid shrugging your shoulders or leaning backward. Aim for 12 to 15 repetitions per set and complete 3 sets, resting about 1 minute between sets. Choose a band that makes the final few repetitions challenging while still allowing good form. As strength improves, you can increase resistance by using a thicker band or slowing down the lowering phase. This exercise is joint-friendly and highly adaptable, making it suitable even for individuals with arthritis or limited mobility. Strong back muscles act like guy wires on a tent, keeping the spine upright and stable. By restoring the support system, seated rows not only improve posture and reduce pain, but also enhance balance, breathing efficiency, and overall confidence in movement, benefits that walking alone simply cannot provide. Number 1. Sit-to-stand squats. If you could only keep one exercise for the rest of your life, the sit-to-stand squat would be the smartest choice, especially after 60. This single movement trains the exact muscles and coordination patterns that determine whether you remain independent or gradually become reliant on help. Every time you stand up from a chair, rise from the toilet, get out of a car, or climb stairs, you are performing a version of this movement. When it becomes difficult, daily life becomes difficult. That is why clinicians, physical therapists, and surgeons place enormous importance on it. The sit-to-stand squat activates nearly every major muscle group in the lower body simultaneously. The quadriceps straighten the knees, the glute muscles extend the hips and protect the lower back, the calves assist with balance and force transfer, and the core muscles stabilize the spine so the movement is safe and efficient. Unlike walking, which mainly uses low-level endurance muscle fibers, this exercise challenges strength, coordination, and power at the same time, the exact qualities that decline fastest with age. One of the most compelling reasons this exercise matters is its strong link to longevity and functional health. A large 2014 study published in the European Journal of Preventive Cardiology examined middle-aged and older adults and found that the ability to rise from a seated position without using hands was strongly associated with lower mortality risk. Each additional point scored on the sit-to-stand test was linked to a meaningful reduction in all-cause mortality. In simple terms, the better you are at standing up from a chair, the better your long-term health outlook tends to be. Beyond prediction, training this movement produces real, measurable improvements. A 2019 randomized controlled trial in adults over 65 showed that a sit-to-stand focused training program performed just 3 times per week significantly improved leg strength, balance, and walking speed compared with a control group. Participants also showed improvements in muscle quality, meaning the muscle became stronger without necessarily needing to grow much larger, an important factor for older adults who may not tolerate heavy loads. To perform the sit-to-stand squat correctly, start seated on a sturdy chair with your feet flat on the floor, slightly wider than hip-width apart. Keep your chest tall and your spine neutral. Cross your arms over your chest to avoid pushing with your hands. Lean forward slightly at the hips to bring your weight over your feet, then press through your heels to stand up fully, straightening your hips and knees at the same time. Pause for 1 second at the top to reinforce balance and control, then lower yourself slowly back down over about 4 seconds, keeping tension in your legs and barely touching the chair before standing again. Begin with 8 to 10 repetitions and build up to 3 sets of 12 to 15. Once this becomes comfortable, progression is simple and safe. Slow the lowering phase even more. Pause longer at the bottom or hold a lightweight or household object against your chest. Surgeons increasingly recommend this exact movement to patients recovering from hip and knee procedures because it restores real-world strength more effectively than many machine-based exercises. Master this movement and you are training your body for life, not just for exercise. To wrap things up, these 5 chair-based exercises represent what many orthopedic surgeons and geriatric specialists now consider essential strength training for adults over 60. Walking still has value for heart and lung health, but on its own, it does not do enough to slow muscle loss, protect bone density, or maintain the strength and balance needed for daily life. Targeted resistance movements, especially safe chair-supported ones, Fill those gaps by training the exact muscles that keep you independent as you age. The best part is how simple this can be. You don't need a gym, expensive machines, or years of experience. All you need is a sturdy chair, maybe a resistance band, and about 15 minutes 2 to 3 times per week. Start slowly, focus on good form, and progress at your own pace. Consistency matters far more than intensity. If this video helped you, hit the like button so more people can see it. Subscribe for more senior-focused health tips, and tell us in the comments which exercise you'll start with first. Your future strength starts today.